Hi everyone, I'm just going to take a few minutes and go through chapter 41, which is assisting in geriatrics. Geriatrics are elderly patients, those who are over 65 years old. A geriatrician is a specialist who actually takes care of specifically elderly people. Typically, the older the population have, the more health concerns they have. Therefore, they may actually spend more time at the doctors, and you as medical assistants may spend more time caring for them. It's important to know that all body systems show signs of aging, but not all people experience those changes at the same time or rate. Next, we're going to go through some changes or things that you might see in each body system as people age. Again, this doesn't happen at the same time for every person, but it does typically happen. In the skin or the integumentary system, you could see thinning and wrinkling of the skin. You could see atrophy or basically breakdown or degeneration of the fatty layer of skin. Decreased number of cells that produce pigment, which are melanocytes. Those pigment producing cells, melanocytes, help protect against UV light like the sun. Melanocytes that are still present end up gathering together and form brown spots or lentigos or liver spots. You could see graying or thinning of the hair and brittle nails. You also see decreased inflammatory response, which actually slows down the healing process in time. Some changes that you might see in the nervous system include slower reaction time and thought processing, decreased blood flow to the brain due to arteriosclerosis, which is a group of disorders that cause thickening of those artery walls. We brought that up, or I talked about that a little bit when we were talking about blood pressure yesterday and how blood pressure is that pressure on the inside of the walls of the arteries. You could also see shortened attention span and difficulty handling several tasks at one time due to decreased frontal lobe size. You also get shrinkage of the temporal lobes, which leads to weaker signals to the brain for processing. You can see impairment of fine motor activities such as writing, caused by shrinkage of another area in the brain called the substantia nigra, which is a layer of gray matter in the brain. When we get to next semester and we talk about the nervous system, we talk about the gray matter and the white matter in the brain and in the spinal cord. The other thing you could see is memory loss, which is caused by the changes in the part of the brain called the hippocampus, and lack of acetylcholine, which we'll learn more about next semester as well, which is a neurotransmitter which helps send those signals from the brain to where they need to go. Special senses, which are typically eyes, ears, nose, like sense of smell, vision, hearing. You could have altered or decreased taste sensation, which can lead to malnutrition because food just doesn't taste as good to them, so they have a difficult time eating. You could also have impaired vision and hearing. With the musculoskeletal system, you could see osteoporosis, which is decreased bone density or how thick or strong the bones are, which can lead to increase in fractures, especially in the hip area. That's most common. When you have osteoarthritis, that's another term for degenerative joint disease. I think that may be a question on the test. Decreased number of musculoskeletal fibers, so you just don't have as much or as many or as strong of muscle fibers, and so they tend to be a little bit weaker. With the cardiovascular system, which is the heart, you'll see decreased cardiac output. We talked about cardiac output, which is how much blood or fluid is coming out of the heart when the heart pumps. Because the heart is a muscle and it's weaker, it won't be pushing out as much fluid out of there or blood. You see arteriosclerosis, which is thickening, and narrowing of those blood vessels. You can see postural hypotension, which is decrease in blood pressure, or a loss of blood pressure when standing or sitting abruptly from laying down. That can lead to a multitude of issues, including falls, fractures, injuries of that nature. You can see increased risk of heart disease as well. With the respiratory system, which is all about breathing in your lungs, you will have some loss of elasticity of the lungs, which is how the lungs expand and contract. You could see calcification of the intercostal cartilage, which is actually the cartilage that is located between each of your ribs, and development of kyphosis, which is that curvature in the spine. Increased shortness of breath caused by the changes above as well. Some changes that you might see in the immune system would be that you're more susceptible to infectious diseases or autoimmune diseases such as cancer or rheumatoid arthritis. With the digestive system, you could see constipation, which can be caused by a couple different things, including lack of exercise, poor diet, poor fluid intake, and possibly even side effects from their medication. In making sure that elderly people are up and moving and drinking enough fluid is really important to help with that constipation. Other things that you might see could include fecal incontinence, which is caused by a lack of muscle tone. And that basically means that they're unable to hold their stool, and they could be having accidents where they have a bowel movement without being on the toilet. The urinary system, you have a decrease in the number of nephrons, which are basically the little filter unit cells in the kidneys, and so they don't filter as well. The kidneys filter blood slower, causing reduced tolerance to stress, medication, and illnesses. Then you could have a loss of voluntary control of your urination, which can lead to quite a few things. It can lead to embarrassment, depression, anxiety, because they're really anxious and embarrassed about having accidents. With the endocrine system, which is basically all your glands and hormones in your body, you would see decreased thyroid function, loss of estrogen producing in postmenopausal females. You have decreased levels of aldosterone, which is a hormone that regulates blood pressure, so your blood pressure regulation is a little bit more difficult. Increase in the time it takes for the levels of hormone cortisol to return to normal after stressful events. And again, we will learn more about the endocrine system next semester. But this is just kind of a brief overview of what could potentially happen. You also might have deficiencies in response to insulin by various organs. So you could be looking at potentially diabetes, type 2, and issues with that. Some cognitive or intellectual development with the geriatric patient. It may take them longer to process new information. There's that phrase, you can't teach an old dog new tricks, just because it may take them longer to learn it. They may not want to learn it. They may be kind of stuck in their old ways. The other thing is if you know geriatric patients and you've worked with them before, they could tell you a story from 50, 60 years ago and know all the details of it, but they can't remember what they had for dinner last night. So their long-term memory remains the same. However, their short-term memory may be a little bit less acute or accurate. Psycho-emotional development, they may feel loss or grief when they no longer have a career. We talked about that yesterday in class when we talked about when a person retires and how they've had the same job for 30, 40 years. Suddenly they feel very kind of lost and they don't feel like themselves. It may help with the transition if they develop interests outside of their career. Deaths of friends and spouses can have a major effect on a person's emotional and psychological status. And sometimes physical ailments and the inability to function on their own may lead to them needing more help from their family members. However, they don't like to ask for help. They feel like a burden. And so that can also have a great impact on them. Social development, they may have an increase in their spirituality, they may remain in their home, or they may move to like their dream home, and then they may spend quality time with their grandchildren, and they may volunteer. When you're thinking of taking care of a geriatric patient, you want to encourage regular weight-bearing and aerobic exercise to reduce and prevent bone loss. When we talk about later this semester, the bones and the muscles, we'll talk about how just simple movement, walking, will actually pull on the muscles or make the muscles move. And that actually pulls on the bone, which stimulates the bone to produce more stronger bones. And so it's really important, even just those regular weight bearing exercises like walking is really important for preventing bone loss. Providing patient educations regarding a balanced nutritional plan based on what medical problems they have is really important, so they can try to minimize the effects of the medical problems that they're having. Question mature adults about their sleeping habits, encourage socialization, get them into like a senior citizen group or, a group of older people who get together and, go for walks or play cards or something. So that way they still socialize. Encourage the patient to continue getting their regular healthcare checkups, dental care, and screening exams. And remember the old phrase, use it or lose it. It definitely applies. You want to make sure their brain is active to help maintain their mental function. Some common diseases and disorders of the geriatric patient. Alzheimer's disease is probably the most common, or not the most common, but the most frequently talked about. So Alzheimer's disease is a severely debilitating progressive brain disorder which causes changes in personality, mood, and behavior. While it's not quite understood, why or how it happens, what they've determined is that fiber tangles with neurons. You have degeneration of nerve fibers and decreased production of neurotransmitters, which are those fluids that help continue to send nerve signals on. And that's what causes the symptoms. It's associated with advanced age, potentially family history or certain genes, and potentially some environmental factors. When you have a person who has Alzheimer's disease, they'll have memory loss, confusion, personality changes, oftentimes language deterioration, impaired judgment, and restlessness. There is no cure, but the goal is to help slow down the process, and you can do that with medications, proper nutrition, exercise, social activity, calm environments, and keeping the brain active. The primary role of the caregiver is to provide comfort and safety to the patient. You can see that chart on page 866. Actually, it's not going to be on 866 because of the change in page numbers, but there is a chart in your book all about Alzheimer's, and so you can take a look at that, and it'll have a little bit of information for you. There is patient education about working with geriatric patients, or how to provide patient education to them in that chapter, in your chapter 41 as well. Again, the page number is not accurate, but it is in chapter 41. If patients have hearing or vision problems, you want to make sure that you're speaking directly to them. Don't over accentuate your lip movements. Sit at their level. Speak in clear, low-pitched tones. Try not to just over accentuate, your movements or your hand gestures, because oftentimes they're just reading your lips and they have practice doing that. And so you want to just make sure you're talking normally. Other things you can do is put instructions in writing for them, print them out, and you could even print an extra copy for maybe their caregiver, son, daughter, a spouse, whoever may be assisting them in whatever they need to do at home. With the geriatric population, you often see lack of compliance with taking medications, and this could be because they have a difficult time keeping track of if they've taken their medicines or if they haven't. It could be related to cost as well, because they could be on a fixed income. They may feel like they don't need the medications. They could have a hard time swallowing them. Taking a lot of medications at once may make them feel sick. And so really, the goal is to educate the patients on why we need to take them, what are the expected side effects with it, what they should do if they have some side effects, and then also give them some tools so they can remember to take their medication and making sure that they don't take too many or forget they took it and take it again. And so we have some tips and tricks here. We can give them medication reminder boxes or like those little med organizers. You could have timers that go off and then they would take their medication. Print them a medication list and hang it on the wall by where they keep their medications. Make sure you educate them on why they're taking the medication and how important it is. And to make sure you tell them, even if you're feeling better, you need to continue to take this medication for however long the doctor has prescribed it. Oftentimes they'll take medication, they're feeling better, and they'll stop taking it because they think, well, I'm feeling better, I don't need it any longer. If it's expensive and they can't afford it, you could also refer them to a patient assistance program. With the elderly, preventing falls is extremely important. Elderly can have falls due to vision problems, slow reflexes, that postural hypotension where they get dizzy and lightheaded because their blood pressure drops. They could have changes in their ear that cause equilibrium or balance issues. And then sometimes their medications they're taking for all of their chronic medical conditions can make them either less alert or even dizzy or lightheaded. Some ways that we can prevent falls, we want to make sure they remove reading glasses, use night lights, move slowly, as in when you go from laying down to sitting up, sit there at the edge of the bed for a minute before you stand up. Make sure they're wearing well-fitting shoes. Use those supportive devices like walkers, canes, handrails, shower chairs, those type of things, so that way they don't trip and fall. You can use secure rugs and floor coverings, but just be cautious of those rugs that have like fraying on the edges or they could trip over. As a medical assistant, you will want to observe for elder abuse. It can happen, and it does happen, unfortunately. How you can do that is just by being observant, taking careful histories, and then note the interaction between the caregiver and the patient. Polypharmacy is where geriatric patients take several medications at the same time. Age-related changes in the body can affect how the medication is absorbed, how they break it down, and how they get rid of it. As people age, they have an increased risk for basically toxicity or getting too much drug in the system. Because we mentioned the kidneys are the filter and they break down things to get rid of things, if they're not working as well, sometimes that medication can build up in their system. And so you want to make sure that you're keeping a close eye on, the doctor's keeping a close eye on that, and you're verifying with the patient how much medicine they're taking and how often. Elderly patients may also become confused about what medications they're taking or what dose they're taking. They may take old pill bottles, of medication that they have left over at their house and still take them when they should be stopping them. And so getting them really organized and making sure they understand what medicines they are taking and why and how they should be taking them is vital for the geriatric population. These are just some common diseases and disorders that the geriatric population might see. The ones that you want to focus on for the test are going to be Alzheimer's disease, arthritis or osteoarthritis, and osteoporosis. So if you want to take a look at those, this chart is in, let me see, I think it's in chapter 41. I just have to move this. Yep, in chapter 41, you will find that chart. And one other one, sleep apnea, there is listed. And that is it. That's it for chapter 41, the geriatric chapter. Remember to make that note card and include some little information about the geriatric chapter. Just remember with the geriatric chapter, pretty much every body system is affected and they all kind of slow down and not work as well. Have a great day.